This is All India Radio. In the program Spotlight now, we bring you a discussion on vaccine development for COVID-19. The participants are Dr. Narendra Saini, former Secretary General IMA, and Aditi Tandon, journalist.
10 months into the outbreak of the COVID-19 pandemic across the world, India has now registered around 75 lakh total cases. And over the past few weeks, there has been a consistent and declining trend in the active cases. As of today, when we speak, we've seen only 46,790 daily cases of COVID, which is the smallest rise in 84 days, which means in about 3 months. The last we saw around 50,000 cases in a day was around July 29. So good signs are appearing on the horizon, Dr. Saini, in the sense that the disease load appears to be decreasing. And there is a government panel which conducted a super model study, a mathematical modeling by experts of IIT Hyderabad, which actually said that the COVID pandemic in India has peaked in September. And the expectations are that if we continue to practice COVID-appropriate behavior, we can actually control the pandemic by early next year, not end it completely, but control it significantly. Whereas the disease load is decreasing, all eyes are now on the vaccine development across the world. As you know, Prime Minister Narendra Modi, during his keynote address yesterday at the Grand Challenges annual meeting, which was attended by Bill Gates, said that India was at the forefront of vaccine development. 30 indigenous candidates are in various phases of development, and 2 of them, as we know, are quite advanced in trials. One is the ICMR Bharat Biotech candidate, and the second is the Zydus Cadila candidate, which are indigenous. The third, of course, the Serum Institute and the Oxford University candidate is also under trial in India. So, Dr. Saini, we would like to understand from you, what according to you is the biggest challenge to vaccine development going forward?
Once we talk about vaccine development, it is not only development. It constitutes 3 important aspects. One is the vaccine development, other one is its production, and third one is distribution, and fourth one I will add into it is actually giving the vaccination. These are 4, I think, different subjects, and each one is very important. First and foremost, yes, which we call it as a vaccine development, where you actually have a vaccination, and right now there are more than 40 candidates which are working, and you rightly said there are 4 in the forefront, 2 in India, which is Bharat Biotech, and the other one is Zydus Cadila. The third one, which is I think at the front, is with AstraZeneca and Serum Institute and Oxford University. I think these 4 candidates are there, but the other 3 also the important aspect. How you will produce, how you will distribute, and then actually how you will give the vaccination.
Already the government has constituted a National Vaccine Administration Task Force, and there are 6 various subgroups under that task force. Different subgroups are looking at different aspects of vaccine development and later on, as you pointed out, distribution. Dr. Saini, do you think India will anyway be in an advantageous position as compared to the rest of the world because our vaccine manufacturing capacities have been traditionally high and we are already giving 60% of the UNICEF stockpile of vaccines which are being distributed globally under various programs of the WHO and the United Nations. So we already have a very strong indigenous vaccine manufacturing capacity. Don't you think that will place us at an advantage as and when vaccine candidates are tried and they succeed?
You are very right in that, because vaccination development is one and the production is very important, and in this we are fortunate that 60% of vaccination today of the entire world we are producing. So we have the manufacturing capacity, and moreover, the bureaucracy is taking interest, and I will say the topmost person of our country, the Prime Minister, is taking a keen interest into that. So that production can be enhanced much further since there is a backing of the government. Government has done a very good thing about it, that whatever vaccination will be produced, whichever company, international collaboration, 50% of that will be for indigenous use. It means for our own country people it will be used. That is a very significant step been taken so that our people are not denied of. It is not only the rich countries are taking that vaccination. Globally, our Prime Minister has done one more thing. Along with that, another 50% will be going towards the poor country of the world. So that is a good gesture from India, and India has the capacity to do it since we are already have a good production line.
Another major issue that is being debated in the National Vaccine Administration Task Force is with respect to the availability of syringes and vials and all kinds of infrastructural issues that would be needed to be addressed in advance, so that once the vaccine candidates are ready to be launched into the market and ready for administration, the infrastructure has already been laid down. So what I wanted to understand from you is that since we already have a national immunization program, but the capacity of that program would be limited, isn't it? Because that is only for children, and that is only about 270 lakh children, that is the birth cohort of India annually, that we vaccinate under the National Immunization Plan. But administration of COVID vaccine is a once-in-a-century challenge, isn't it? That kind of distribution scale the world has never seen before.
You are very right in that, because that whatever vaccine production and vaccination is to be given, it is planned for throughout the year. Means for 12 months we are giving right now to around 405 million children and to pregnant females, but it is spread to entire year. But here the challenge will be to give in the shortest possible time, not only to our country but to the entire world. That is a big challenge. But right now, again, there will be a challenge that whom to give first. So that also to be taken in a priority wise, that yes, healthcare workers, then those who are vulnerable age group, those who are above 60 years, those who are below 10 years of age, those who are having comorbid conditions, then how to distribute, that will also be a challenge. Then since this vaccination will not be given, so far we have the knowledge that it will be an injection, so everybody cannot give injection. It is not like polio where oral drops can be given to anybody. Then a trained healthcare workers is required. So all these challenges are there, but I think we are capable of it.
Another discussion is around the delivery platform, Dr. Saini. And Prime Minister Modi made a very important statement yesterday when he said that India is already working on putting well-established vaccine delivery system in place, and a digitized network along with digital health IDs will be used to ensure the immunization of citizens. We already have a national digital health mission, which is not very old. In fact, it's very recent, and it was launched only recently. And if you recall, Prime Minister Modi during his Independence Day address this year had announced that we will have digital health IDs for all Indians. What do you make of this digital health platform for being used to vaccinate the population? Because you would have to identify people who have to be vaccinated, and how will you do it? So perhaps that is the idea, to have a digital health ID.
That's very important, to identify people. Digital health will be important, but at the same time, which you have touched upon, the distribution, because there is a cold chain requirement. India is widely spread. The remotest area where electricity is a problem, where maintaining a cold chain will be a problem. So these will be major issues. Yes, identifying people through a digital will be important, but at the same time, if you recall, Prime Minister also said that we have to work like we are managing a polling booth. So this will help us, because we have the capacity to manage poll. We are doing manually all these things. So I will say digital as well as manually, both will be important.
That's a very important point that you made, Dr. Saini. The fact that Prime Minister earlier mentioned that we'll have to actually look at it like electoral management. In fact, today Health Secretary Rajesh Bhushan made another very important comment, and he said that just like in an electoral scenario, multiple IDs are prescribed to ensure that people are not denied of their right to vote. Similarly, multiple IDs will be prescribed for COVID vaccination so that nobody is left behind. And it's not as though digital health IDs will be mandatory. They will be used wherever possible.
The idea behind is, in this case, even two people are left, they are not only vulnerable to themselves, but they can spread the infection to others also. Anybody who is left behind, I think the government or any institution would not like to do that, because that is a case which can spread the infection again. In order to eliminate, each and everybody has to be vaccinated, like smallpox. How we did it? Because everybody got vaccinated and now this virus is eliminated. Otherwise, if you would have been left at that point of time, this virus would have been remained throughout in our country or in the entire world. So here also the same principle applies. Whatever means we are using, digitalization or other means of identifying people, but the idea behind is that nobody is left without vaccination. But then, since the production line cannot be very high initially, so prioritization has to be done whom to give a vaccination first.
Prioritization, I believe, has already been done to some extent, and the draft priority list is ready with the government. And as you mentioned earlier, that healthcare workers will get top priority, plus people with comorbid infections will get priority, and all frontline workers will naturally be prioritized for vaccination. Already the government supermodel study, which the IIT Hyderabad and other scientific institutes have conducted, and it was launched 2 days ago, has said that as of today, about 30% Indians are likely to have already developed antibodies to the COVID SARS-CoV-2 virus. And going forward, when they are predicting that COVID pandemic will be controlled if we continue to wear masks and maintain precautions, by February 2021, this committee has predicted that 50% of Indians would have had developed antibodies. Whether this is a good sign and whether people who have antibodies to the virus would also need to be vaccinated, or can they be then left without vaccination?
I do not agree with that. What the observation is 30% people are already infected with this virus and they have antibodies. There are different theories. Even a few days back, the ICMR study has said that only 1% of people had antibodies. So huge population is left, and in order to have a herd immunity, you need to have at least 60% of people having a COVID antibodies in them. So I think it is not going to happen very soon. And with that, if we allow this herd immunity to occur, so many people will die. Vaccination has to be fast. It has to be done.
Now, coming to the influenza and respiratory viruses, Dr. Saini, we have seen a number of viral diseases. For instance, we've seen HIV research has not thrown up any efficacious vaccine in decades. Then we saw H1N1, we had a vaccine, but there have been concerns around the fact that the virus mutates so fast that the vaccine produced in one season may not be effective in the other season. What are your own concerns around the efficacy of any vaccine that will be developed around coronavirus?
Coming to corona, this is also an RNA virus. And RNA virus mutate very fast. Right now, whatever vaccination we produce is going to be effective because virus has not mutated to a great extent. Small mutations are there, but not to a great extent. But there is always a challenge. This virus can mutate, and whatever vaccination we are producing may become ineffective, like influenza, you rightly said. But at present, it is still a stable virus. It's not mutating that fast. So hopefully, we keep our fingers crossed that God knows only or this virus knows only, because the novel virus we are seeing for the first time.
We have seen in respiratory viruses, majority of them do take decades for major shifts. As we know that there are drifts and there are shifts. Drift means a small mutation, as you just pointed out, and shift means...
But as I said, luckily I'm saying this one is not mutating, but RNA viruses are known to have shift. Drifts are always happening. Everywhere drift is happening. But the shift is happening much faster in RNA virus than in DNA viruses. And this being a RNA virus, there is always a fear in our mind as scientists or as doctors that it might not change drastically. That is called a shift. If the shift happens, then whatever line we are taking at present for a vaccination, that will go haywire. Drift is already happening, but that has no issue at present. But if something shift happens, yes, it is a fear in the mind of all doctors and the mind of scientists. This being an RNA virus, then it is an area of concern.
Dr. Saini, do we know already through some kind of scientific research as to how many years should we be fine once we've been vaccinated by a COVID vaccine? How many years of immunity will such a vaccine give us? Do we know that or don't we know that right now?
We know for certain other diseases. Since, as I said, it is a novel virus, we do not know much about it. Because what happens with the virus when we vaccinate? Patients develop an antibodies. It is called an anti-missile. The missile is a coronavirus and we produce an anti-missile on that. So we call this as antibodies. But these antibodies we have seen recently, whosoever is getting this antibody, they are finishing fast. Normally, these antibodies remain for a longer period of time when a person gets infected with particular things. But with the corona cases, we are seeing within 3 months, the antibodies are going down. So we cannot predict at present how many vaccination will be needed. At present, what we can say is at least one should have one vaccination, and whatever the research or trials which are happening, one or two vaccination will be required, which will produce enough antibodies that it will inhibit the transmission or infection of the virus for a particular moment of time. But whether it will be needed after 4 years or 3 years, the time will tell us. There is no answer to this question because this is a new virus. We are all studying this virus.
Thank you so much for your time. As you said, it's a novel virus and everybody is keeping their fingers crossed. Thank you so much.
Thank you.
You were listening to a discussion on vaccine development for COVID-19. The participants were Dr. Narendra Saini, former Secretary General IMA, and Aditi Tandon, journalist. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR. This program is also available on our website newsonair.com. You may email your opinion about this program at airnsdtalks@gmail.com.